Well, good afternoon, everyone. My name is Leslie Van Zelst-Lempp. Yes, that's a mouthful. Um, and I will be presenting monitoring your heart rate today. Quick little background on myself and as to obviously why I'm here presenting this topic. I am the current clinical lead of the Preventive Cardiology and Rehabilitation department at Cleveland Clinic Canada. My previous role was clinical lead of exercise physiology, and I am also still currently an exercise physiologist at Cleveland Clinic Canada. So lots of background there to discuss this topic. For actual virtual running, a lot of you, I think, that are also onto this program did our previous program that Beth and I did. Obviously, that one was live, so we miss seeing all of you in person. But I ran that program as well. Been an avid runner probably since my varsity basketball days were over, trying to go into something else after graduation. And I got into some running and then into triathlons. So running's always been near and dear to my heart. Still do quite a bit of running, not as much as I used to. These knees are starting to wear and tear, but obviously I still love running and love being part of this program. So again, welcome everyone. So I think we will get started. I know I see some people still getting checked in, but yeah, we're about 2 minutes after, so we're gonna get right into it. Okay. So just a bit of an overview of what we'll be discussing today. Why heart rate matters, of course. Just to kind of put it out there already, what I love about this topic is that, again, if for whatever reason, thinking about tracking heart rate, this frightens people for some reason. Most clients that I see, when I ask how they're gauging intensity, most people actually aren't looking at their heart rate. So it's a very exciting thing because it's not as hard as people think. It's a really excellent way of keeping track of things. So why heart rate matters, that's a really fun part of it, because again, you'll end up seeing there's nothing scary about it. So first we'll go into resting heart rate. So we'll talk about why that's important. Maximum heart rate, of course. How to calculate your heart rate training zones. We'll talk a little bit about, there's different ways of doing it, and as an exercise physiologist, what ways we find to be the most accurate, obviously through evidence. Using heart rate to detect overtraining. This is a biggie. So really cool things that the heart rate can tell you when it comes to that. And recovery, as I'm sure we've learned even in past presentations, is very, very critical. Wearable technology for heart rate training. So I'm sure, according to statistics anyway, about 62% of the population has a wearable at this point. So I'm sure a lot of you already have one, and we'll be discussing kind of the ins and outs of them, and what to look for, and possibly what can help you a little bit more. So that is our overview. So first one, okay. Why do we give a crap, right? Why does heart rate matter? One of my favorite things to say about it is it actually is your personal full-time coach. So once you learn how to use it properly, not to say you don't end up needing people like me, you still do, but you really can see what your body is up to and what it's trying to tell you. And it even in the most subtlest of ways, it can tell you so much. So not necessarily needing to hire anyone, right? Once you get your feet wet, you'll know all about it, and you can be your own coach. So it's a really super cool thing. It's actually easy to measure, contrary to popular belief. It's actually pretty easy to do and to monitor and track over time. Definitely, obviously, informs you of your current state of fitness. And lovely thing, which is why people like me do a little dance, really can show when things are getting much, much better, and unfortunately also when things are getting worse. But the better is obviously the more fun part. Takes the guesswork out of training intensity, of course, so that one's pretty straightforward. Gives real-time feedback when training or racing. On that particular point, even when it comes into wearables, we'll talk about that, of just, there are some wearables that aren't giving you that real-time feedback unless you've got your phone open with your app open. So these can be important things when you're choosing even a wearable, because if you're in a race and you got to pull out your phone to actually look to see where your heart rate's at, that's obviously kind of cumbersome. If it's right there on the watch right in front of you, it's obviously a lot better when it comes especially to racing. So just a little little snippet in there. Definitely an early predictor of fatigue and overtraining. So this is something with my patients that I watch like a hawk, because yes, exercise is obviously good in millions and millions of ways, but there is such a thing as too much. And we need to be aware of that as well. Okay, so heart rate and exercise intensity. So just wanted to put this slide up just to make it perfectly clear of why tracking heart rate is such a cool, more or less blatantly why it's our great coach for us. So because there's more or less such a linear relationship between heart rate and exercise intensity. So what you'll see on the x-axis there, of course, is your heart rate, and then on the y-axis is your VO2. So again, just showing that intensity, as heart rate goes up, right, so does that VO2. So as we're asking more of the body, obviously, and as more oxygen's being consumed, that heart rate, of course, is going up at the same time. So as you see your heart rate going up as you're training, right, we know that more is being asked of that body. So it's so nice, because even if we, obviously I'm very lucky at our clinic, we do hundreds and hundreds of VO2s every week. So we can see right in front of us. And then what's cool about that, of course, is that we can give you exact heart rates to know how to create change in your body. But even if you don't have that kind of technology, just tracking that heart rate can really show you how much you're training, like what you're doing, right? Like what you're asking of your body. So as you're going up again, now, of course, there is a limit to this, right? So it has that linear relationship up to about a submaximal workload. And then, of course, that's interesting enough, what we call our VO2 max, you are going to hit that peak, and then obviously that consumption isn't going to continue. But what's great about the heart rate, again, is that it shows us along that way. And then once you've hit that peak, we can obviously see what continues to happen, but you would know that as well if even just you're paying attention to heart rate. So really cool thing. Again, the main thing I take away there is that linear relationship. So if you learn how to track heart rate, you can basically learn how to improve your VO2, which is super, super cool. Okay, next slide. Okay, resting heart rate. So lots of research behind, again, like there is a bit of lag time when it comes to taking it ourselves, which is why wearables have really become a really neat thing when it comes to training, because again, it is real time. A lot of time when we have to stop and take our resting heart rate, there is a little bit of that lag in time of having to stop and to find it. And research would say there's anywhere from well, for most people anyway, from about a 5 to 8 beat difference between when you stop and take it. So some of us, our heart rates can come down that fast. So either way, though, it's really important to know yourself. So I always tell people that even if you have a wearable, it's just for a lot of reasons too. Like, let's say you start experiencing little bits of an arrhythmia. You're not going to, honestly, unfortunately at this point anyway, most of the wearables aren't sophisticated enough to be able to catch that. So if you can actually take your pulse yourself, you can actually tell what's going on. So best thing, of course, when you're estimating your resting heart rate is to take it when you wake up in the morning after a good night's sleep. I know a lot of us suffer from having a good night's sleep, even during these times, even more so I find with patients I'm speaking to, but it's definitely best if you have a good night's sleep to get a good accurate rating. You want to use your radial pulse, of course, at the wrist. I always tell people one of the best things to do is just travel down that thumb, and then it's pretty easy to find. You don't want to be pushing down too hard. It's just nice and light to actually feel that pulse underneath. You can take it at the neck, so that's something that some people like to do. Usually, again, I've spent most of my career in cardiac rehab. We normally caution against that because sometimes people apply too much pressure, and it can actually sometimes impede a little bit of flow up to the brain. So we tend to want you to go by the radial pulse if you can. You're going to count, again, there's 2 ways to go about it. You can count for 10 seconds and multiply by 6, or count for 15 seconds and multiply by 4. For that nice quick assessment. There is a lot of variation, so a lot of the time if you want to get something very accurate, I usually do tell people to compare over approximately a good work week, right? So try to take it every morning at the same time, right when you wake up, when you're nice and rested, and kind of take that average to get a good, strong, consistent look at what your resting heart rate might be. Okay, next slide, Sophie. Okay, so what affects resting heart rate? So quite a bit affects resting heart rate. First and foremost is the environmental factors. I find most people are pretty familiar with this. So extreme temperatures, definitely going to make that resting heart rate climb. Dehydration, I think most of us have experienced that, and it can actually definitely make that resting heart rate climb as well. Food products, lots of different things. One of the most common ones, of course, is caffeine. So caffeine obviously raises the resting heart rate. Body position, important. Obviously, your resting heart rate is going to be quite different from laying down versus standing up. So if you're trying to get again, we are taking that resting heart rate, trying to get a good average. You're going to want to make sure you're not jostling between the two. You're either laying down or you're standing up. So age, resting heart rate definitely does change with age. Stress, this is a pretty big one. So stress definitely causes that resting heart rate to climb. We'll get into that a little bit more later, and what the resting heart rate can show. Gender, the ladies in the audience won't like this, but research has shown that females have higher resting heart rates. So lots of things that can affect the resting heart rate. Okay, next slide. Okay, so exercise training results in a lower resting heart rate. I know this one seems pretty obvious, but that's again why we end up doing a bit of that happy dance, is because when we see that happening, again, you don't have to come to see someone like me to retest you to show that you're getting more fit. Even the resting heart rate itself can show that you are, so that you're getting more efficient at rest. So again, you'll notice that decrease in resting heart rate. Some of you may have seen this already this many weeks into into our virtual running program here, and I'm super excited for you if you have. Aerobic training, of course, results in a lower resting heart rate. The main thing behind this, of course, is total volume. So an increase in the heart stroke volume, the amount of blood pumped during each beat. So that's really what we're after, right? You want to have, and then of course, if you go down the way, oh, sorry, as far as I can see my slide, we've got some things popping up. The increased input from the parasympathetic nervous system instructs the heart to beat less frequently. So again, lots of great things coming from aerobic training. But again, the main takeaway from that, of course, is that if you see it going down, you know you're getting more fit. So some great feedback there. And what I find with that too, again, a lot of this, even continuing your runs, I'm sure a lot of you are struggling, you know, a lot of days with that of finding motivators to keep going. Seeing that resting heart rate and that aerobic training, seeing all that improve can be extremely motivating. So if you're someone who's watching heart rate, it's a nice little kick for motivation as well. Next slide. Okay, I just thought I would give you guys a bit of an idea of just sort of the ranges that we tend to see in different fitness levels. So you'll see obviously for men and for women there. Again, when it comes to athletes, even let's say I just turned 40 a couple days ago, so I'm in a new, well, actually no, on this, this is actually nice. On this, I'm actually still in the same box. It's nice. I was saying a lot of other things, I've skipped a box now. So even if I go into that range, so back when I was doing triathlons, of course, my heart rate actually eventually got into the high 30s and even the low 40s. So resting heart rate can get quite low depending on what you're training is actually where you're going with your training. So just thought you guys could give yourselves, you know, even thinking about where you've been recently, if you have been tracking this, you can get a sense of sort of when we assess you, what sort of category you might be put in, even based on your resting heart rate. So right now, even just for myself, definitely, I'm not quite in the athletic range anymore. I would be in the excellent range now. So definitely between that 60, 64. I occasionally get into the mid 50s now, but I would say I'm more into the excellent range now. So just a fun slide for you guys to take a look at there, just to kind of, you know, give yourself a shot in the arm if you are in some of these great categories, and then possibly might motivate you to, right, keep up the good work and even get into a better category. Okay, next slide. All right, maximum heart rate. So again, this is something to keep in mind. So a lot of people, and I have patients ask me this all the time, oh, can I make it better? No, maximum heart rate is not affected by training, and it decreases as you age. So estimating your maximum heart rate, I gave a few examples there. So there's a lot in the research of different ways to estimate that max. For most people, I tell them it's just best to choose the tried and true, which is 220 minus your age. But again, there's a lot of variation to this. So I see people all the time, even personally, I am about 22 beats above my age predicted maximum heart rate. So what I kind of put in the bottom there is just something to keep in mind. The most accurate and safest way is to actually have it tested. But again, And especially during these times, we don't have that option in clinic, but that is the best way to actually have it checked, is to have kind of a maximal graded exercise stress test done, or to have a max VO2 test done, where there's someone beside you, we can push you, we can see what's safe, and then you can actually get that true. So when your calculations, if you are doing calculations, it's that much more accurate. But again, during these times we can't. So again, 220 minus your age is definitely probably the best one to go by. So we can go to the next slide. Okay, but I am going to give you some idea of sort of what comes from different ways of calculating those training zones. So I used, even though I made these slides a while ago, used my future age and now my current age. So again, the first way to calculate heart rate training zones, you can just go by percent of max heart rate method, which, as we can see here, is actually quite straightforward. So as a maximum heart rate, so again, 220 minus my current age is 40, so that puts me about 180 beats per minute. For base training, these were just some examples I wanted to give you guys to give yourself an idea. So let's say base training is between 60 and 70%. So as you'll see there, the minimum, so for myself, the minimum for base training for me would be 108 beats per minute. So that's that 60%. And then the maximum would be 126 beats per minute, which is the 70%. So that's my first category there. If we're doing some more threshold or tempo training, right? So going into that 70, 80% of our maximum heart rate, that's about 126 beats per minute on the low end for me, which is that 70%. And then for 80% would be 144 beats per minute. If we're going into strength, so I know some of you at the end here, we've got our homework for a week. I know some of us are coming into this time. So dealing with strengthening, right? And that's not the muscle. Well, muscles are getting strengthening too, obviously, through running, but we're talking about more or less what you're doing with your training. So we're talking about hills and speed work. So that's going to have you above 80%. So again, at 80 would be 144 beats per minute. And then of course, my maximum would be 180 beats per minute. And actually, when you're doing hills and speed work, it's actually very common to get to that absolute max. Of course, you're not going to hold it for long, but to get up there is perfectly normal to get up there. Okay, so that is the percent heart rate method. And now we'll go to the next method. Yeah, perfect. So heart rate reserve. So this is definitely a more accurate, and again, if you're not wanting to get into this method, that's perfectly fine, but it is definitely something as exercise physiologists we know to be more accurate. So as you'll see, again, my maximum heart rate is 180 beats per minute. My resting heart rate is 60 on average. So if you look at my heart rate reserve, again, heart rate reserve is maximum heart rate minus resting heart rate. So 180 minus 60 obviously is 120 beats per minute. So to do the calculations, you've got your base training there. Okay, so between 40 and 60% of heart rate reserve plus resting heart rate. Okay, so as you'll see on my minimum there, so my 40% is 108, and then the 60% is 132 beats per minute. If we go to threshold for this, again, you're using 60 to 70% of your heart rate reserve plus resting heart rate. So for me, that would be 60% is 132 beats per minute, and then the 70% is 144 beats per minute. Going down into that next category of strength. So again, hills and speed work, that's going to be above 70% of heart rate reserve plus your resting heart rate. So 70% again is 144 beats per minute, and then of course my age predicted maximum is 180. So this is, again, like I said, definitely a method that we as exercise physiologists, if we don't have, the ability to do a VO2 or have a graded exercise test, we will be more likely to use this method. But again, you want to go, especially if you're first getting started with this, use the method that makes the most sense to you, and the one that feels the most comfortable. Okay. Next slide. All right, detecting overtraining, one of my favorite topics. So lots of things that come out of this, but I'm going to focus on two main things. So again, does heart rate show overtraining and under-recovering? Absolutely, and actually on a daily basis. So the first way that it does is by, and again, it's actually coming out a lot more lately, especially with wearables. So heart rate reserve. or sorry, heart rate variation, my apologies. Heart rate variation is one of the first ways that this is going to show. Obviously, I can't pull any of you into clinic right now and actually do a resting EKG on you, but I just wanted you guys to know that that's really what we're assessing when we look at heart rate variation, is it's just that difference between the RR interval. So and really we're talking again about the autonomic nervous system. So we're talking about the sympathetic and the parasympathetic nervous system when we look at heart rate variation. So just to kind of remind everyone, I'm sure you might know already, but the sympathetic nervous system, of course, is that fight or flight response. Okay, and then the parasympathetic is that relaxation response. So when we see more or less low heart rate variation, that means that that sympathetic system is in overdrive. So when there's a lot of stress, when we're not sleeping well, we're not recovering, we're firing on all cylinders, we're not getting appropriate recovery, we're going to see the heart rate variation be quite low. So again, that difference between the RR interval is going to be low. When we see someone who is getting appropriate rest and someone who is training well and someone who's not burning the candle at both ends, we're going to see, again, that high degree of variation, right? So there's a lot of variation in the actual heart rate variation. So that's, again, one of those happy dances, right? When we see things improving, when there's more heart rate variation, we get super excited by that. When it's low, it's something we can point to, right? And we can talk about cortisol levels. We can talk, there's a lot to this, but really in its most basic form, that's what we're after. We want to see high. The other one, of course, is just resting heart rate by itself. When we're fatigued, when we're overstressed, again, that resting heart rate starts to climb. So as an exercise physiologist, again, those are the two, right? Heart rate variation and resting heart rate really detects overtraining extremely well. Okay, next slide. All right, wearable technology. Sorry, I'm just going to check my time here. I want to make sure we've got some time for questions. Wearable technology, again, lots to this. It's actually recently I've been doing even more deep dives. There's a lot more coming on the market. So, oh boy, there's going to come a time where I'm going to actually be able to, I think, prescribe a wearable depending on when I see an entire medical history, when I've gone through all their exercise history, where I could actually say, okay, of these 8, this is probably the best one for you. They're getting pretty interesting. But I wanted to give you guys an idea of sort of what information you want to make sure is there. So age, of course, is a big one. Resting heart rate, this is sometimes either something that you can input yourself, depending on the wearable, or it's calculating it, so where it will take your average over X amount of days. But you want to make sure that there's a component of resting heart rate to your wearable. Your actual maximum heart rate during exercise, you want to make sure that that is a component of your wearable. Even better if you can program it, or even better if it's going to get a sense of what your max is. But again, you just want to make sure that there is a focus on that in the wearable. Custom heart rate zones, this you actually have to be a little bit careful with. So I always tell people, if you have chosen one, you actually want to make sure that you look up, like in your package, and this is what I end up doing this for patients all the time, of whichever one they have. So interestingly enough, there's different zones for different wearables. So the Fitbit, your Whoop, Fitbit, Whoop, Garmin, Polar, they use slightly different zones. So it's really important to know which wearable you pick, which zone, because again, if you've done your calculations and the zone it's going by for your wearable are off, it's going to impact your training. Not in a scary way, but enough that it's going to make a difference. So you definitely want to be really aware of what percentages your wearable is actually using. So next slide. Okay. Making sure the device fits properly. This one's definitely a no-brainer, but actually very, very critical. So as most of you know, there are still two different ways to wear wearable. Obviously the wrist has come a lot further because it's more user-friendly for people. They don't like to wear chest straps. I usually tease the men that I insist they wear a chest strap, mainly because I say, well, that's how the other half lives. So if I'm asking you to wear it on a run, don't complain. Mainly because, again, don't get me wrong, I think the wrist ones, they're coming a long way, but for accuracy, you can't beat a chest strap. The chest strap actually is our way. It's similar for us to actually of putting leads on you for accuracy. So for people that I really need to know the brass tacks, the chest strap is something that I'm always going to recommend. But again, don't get me wrong, the wrist ones are coming a long way. The main thing to remember always is whether you've just got a wrist one or a chest strap that goes with your wristwatch, the fit is critical. You want it to be nice and snug. We're not looking for marks, obviously, but snug is going to be very important for accuracy. The limitations of your device, we've sort of touched on that, right? So, you know, one example would be, again, even I mentioned it earlier, unfortunately, for my own uses, I need a wearable that I can actually see the heart rate. So because I obviously know this stuff in and out, I need to see what my heart rate's at when I am training. So I need to have a watch where I can see it right on the face. So something like the Whoop doesn't really float my boat. It tells me a lot of great things. So something like the Whoop trainer, you know, is focusing on heart rate variability, which is a great focus, of course. It's focusing on recovery. It's focusing on sleep. It does have heart rate strain. So this is more or less just an example of a limitation I find with one of the wearables. It has lots of great things it's tracking, but again, the missing part for me is I don't want to be running with my phone in front of me to see where my heart rate is. And that's the only way through the Whoop that you can actually see your heart rate is if you were to pull it out, pull the app up and actually watch it as you're going. That doesn't really work. So that's a limitation of the Whoop, right? And you'll have, you know, something like the Fitbit that doesn't calculate heart rate variation, or certain models of it. I believe the newest one does. But it is really important to know what you're getting and what you're not getting. And there's lots of things in all of our wellness, you know, for when we're trying to focus on things to be healthier, you do want to pick a wearable that's going to have as many of those things as you can, because again, the greatest thing about a wearable is accountability, right? There's no lying, it's right in front of you. So you either have done it or you haven't. So if you're focusing on that, you're going to need to have one that shows you that. So if something's missing, you're going to be missing something. So the limitations are really, really important. Again, the work zones for your device, we sort of already touched upon that one, so I won't go further into that. This is actually something that, again, I'm very happy to give a list. I've got so much on this now of my own research of wearables, of just even different wearables, what zones they are using, what I find their limitations are for what your needs are. So if anyone's interested in that, I'm more than happy to share it. It's just, again, wearables are going to be the future. There's just going to be more and more and more of them. And it's really important to know what ones are good, what ones are accurate, and what ones have the most functions that are going to help you. Okay, slide. So, the fun time, homework for the week. I feel like I'm talking to my daughter. None of you can yell back at me and say I don't want to do homework right now. So for the Learn to Run group, you're doing your 3-minute running and your 1 minute of walking, 6 repeats, which is 24 minutes of your total, obviously, 3 to 4 times a week, leaving a day in between your runs. So that's for our Learn to Run group. I'll just clap. Every time for these guys, I'm going to clap for each category. Job, learn to run. Your 10Ks. So this week we're doing a 6-kilometer steady run. You're doing a 4-kilometer steady run, and you're doing another 6-kilometer steady run. The total for the week is going to be 16 kilometers. So good luck to you all. Exciting times. You can do it. All right, for half marathon. So you're doing your 9-kilometer steady run. So this is actually my category right now. Your 5-kilometer steady state run and your 5 repeats of your 400-meter hills. So, boy, as I say, there might be some driving around the city to find these hills, but you got to find them. So you're doing, again, that 400 meters, and you're doing your 5 repeats. Okay, so get out there, find your hills. It's time to add it in. You're doing then your 7-kilometer steady run, and then you're doing a 14-kilometer steady run as well. So your total for this week is going to be 35K. All right, so again, clapping for our group. Go half marathons, go everybody. Again, we can do hard things. You guys are doing great. All right, we are to our question portion. Okay, I'm so sorry, I'm just trying to, what do you recommend with regards to Rusco's for detecting training fatigue? You know what, I'm going to have to take that one offline because it's actually been a little bit since I've done kind of a more recent, again, I'm a bit of a research junkie, so I want to get my most current information on that. So if you don't mind, is there a way for us to, because I don't want to give you any information that isn't absolutely current. So let me just get the name down there so I can get your information, and I will email you And I can email the whole group if necessary, the answer to that. So just for detecting fatigue. Okay. All right, next question. Okay, so information, sorry, is there any information regarding lower than normal heart rate, not due to being athletic? Oh, yes, of course. So again, one of the main things to say about this, and same thing with the maximum heart rate, again, your heart is your own, right? So if you do have a lower heart rate, it doesn't necessarily mean that there's anything to be concerned about, right? So it could just be your heart, right? And this even runs in families, lower resting heart rates, higher resting heart rates, higher maximum heart rates. So I definitely wouldn't say that there's anything to be concerned about. What you do want to make sure is that it's consistent, right? So if you do find that there has been some dramatic change to it. So if it's always sort of been you, that's nothing to be concerned about, right? That's just you. If you do notice that it's dipping more and more though, and then if you aren't making changes in your training and you're finding it going lower, that is definitely something to bring up with your physician. Always these types of things you should always make aware to your physician, obviously. And again, they'll tell you the same, that nope, yep, I'm not concerned about it. This is what we know from you. This is consistent with the vitals that we take from you. But again, the main thing is if there's been a change. Okay. All right, so what should be the heart rate targets for the steady state run? Oh, very good question. No, for the steady state, you're more going into that 60 to 70 for your steady state. For some, again, it depends on where you are with your training. You know, if you're, you know, there might be days, of course, too, that you're not up for that percentage for that day. I'm a huge always wanting to remind everyone always that listening to your body is critical. So going by percentages is one thing, but going by how you feel is quite another. But no, for steady state, kind of that 60 to 70, if you find that's a bit too much, you can go to that 50 to 60. Going down to 40 is going a little bit too low. So everyone, we want to remember something when we're moving ahead with our training. We don't want too low and we don't want too high, right? Necessarily, we want more or less that perfect area to continue to create change. Okay, can please provide the info for wearables? Yes, absolutely. Like I said, it's definitely something, and even as we've had this time off, it's been nice to have more time to really go into the wearables. So definitely would love to share that with you, yes. So we're going with our next one here. Okay, I noticed my heart rate stayed in the 60% range 2 days after 4K run. My Garmin Phoenix, okay, shows that I was mid-stress for the full day. Any idea why this happened, and is it normal? Very good question. You know what, again, I actually think I might contact you on that one because I do need a little bit more information, and even like other days, what you've noticed and also what you've been doing on other days to kind of give you that answer. Because if I understand what you're saying correctly, so 2 days after the 4K was mid-stress. And again, it really does depend on what their calculations are going by. I am really finding that to be frustrating with a lot of the wearables is what their algorithms are and what their calculations are. You know, again, are they accurate? Are they evidence-based, right? So now Garmin's pretty great, I'm not gonna lie. So I'm gonna just take that one offline. And again, I'm just gonna get your name down so I can, Sophie, is there a way for me to see these chat questions afterwards so I can make sure I answer them correctly? Because again, some of them I do need some more information.
Yes, for sure.
Perfect. For sure. Okay. So I will definitely get that one to you. Yes, Sarah. Okay. Do you think using 5 heart rate zones for training is too many? Yes. I do think it's too many. Sometimes more, again, it's overkill, right? Obviously, I'm a huge advocate of being scientific with your training, but yes, 5 zones. You can really start to mess around with, again, not using fuels properly when you're doing the overkill. And to me, I guess 5 zones, and again, it's in the research as well, going by that really does feed into more of that overkill. And again, really does end up impacting recovery more than anything else. So I definitely would say 5 is too much. 4 would definitely be more the standard, especially by our evidence as well. So, you know, I'd take a step back with that and go more by your 4. Again, you have to really, journaling is actually pretty important with all of this too, because again, there's so much that can impact it, right? And even if you find yourself trailing into a zone that you haven't in the previous weeks and you're wondering why that is, there's so many reasons why that could be happening that has nothing to do with training. So again, when you're using 5 zones, it makes it very, every day more, I find it raises anxiety for people more or less too. That's just, again, it goes back to that idea of overkill. So yes, let me just see. Should be pushing yourself into that higher percentage of heart rates for shorter or longer runs. Definitely for shorter, again, because you're not wanting to do, if you're on your longer runs and you're pushing too hard and too long, again, you have to remember what we're talking about is fuel utilization, right? And energy production. So we have to be very careful with that. We don't want to be, if you're pushing too hard for too long, again, you're becoming too reliant, for most of us anyway, too reliant on lactic acid as a fuel. And that has a lot of far-reaching implications, especially for the heart, interestingly enough. So if you are going to be pushing more, it's definitely better to do it on the shorter than the longer. And then especially making sure that you are doing, I'm going to reiterate, even I know Dan did this last week, but warming up and cooling down is so critical, right? And especially for that reason alone. If you're going to be pushing yourself, which of course we know is important, you have to make sure that you're dissipating properly as well. So when you're building up that lactic acid, that you're clearing it properly, right? So making sure that those ways of energy production aren't working against you, right? So sometimes training a certain way can work against us, and we don't want that. Okay, so let's see. I'm sorry, they're coming now. Okay, hang on. I'm just gonna get caught up here. Oh, wrap up by 12:40. Oh, I've got 2 minutes. Okay, so unrelated to heart rate, but for the half marathon group on hill repeat day, are we supposed to do the 5K and then end on hills, or is the 5K supposed to be treated as a warm up and cool down? Something like 3-kilometer warm up. You know what? It's a very good question. I believe, I know Beth could probably speak to this one better than I could, but let me just take a look here. I believe it was ending on hills. You know what? Let's see. I would do it in the middle. Okay, so Dan's chiming in there that he would do it in the middle. Okay, again, when Beth designed, I'm not sure what her intention was. It's a very good question. Yeah. Okay, you know what? I think I'm going to move on from that one. Dan's saying to do it in the middle. Okay, let me just see. My wearable tracks how quickly my heart rate drops 1 minute and 2 minutes after finishing a run. Not sure what this data really means. Is there something to look at for that? Absolutely. So again, the quicker your heart rate comes down, honestly, the more effective when it comes, again, it really feeds into heart rate variability as well. So that is actually another show of fitness improving, is how quickly that heart rate comes down. It mainly means you're dissipating lactic acid quickly, and that's what we want. So when we have a lag in that, you know, of course, that's not actually what we're after. And that's something even, you know, we can bring into conversations of vagal tone, which again, it's a bit of a longer conversation, but that's actually a great thing to have on a wearable if it's tracking that, because yes, the faster it comes down, the better. So definitely something good to watch. Okay, looks like we're wrapping up here. All right. Well, thank you very much, everybody. It looks like we're out of our time for today, but I've really enjoyed our time. And please, again, my email is on there. I would be more than happy, especially during these times, please reach out. I'm even happy to do any sessions with any of you personally. This is obviously a huge passion of mine. Obviously, it's what I do for a living as well. So please reach out, and I'd be more than happy to go through anything individual with any of you.